Thank you, Dr. Ekta, and namaskar and good morning to everybody, uh, our esteemed panelists, our experts, our guests, Zoom participants, and all the staff of the Institute, the scientists, the technical staff, the administrative staff, and all our project staff, our support staff, the housekeeping, security, and horticulture staff. A very warm welcome to all of you for the celebration of our 43rd annual day. It is a very auspicious day of Makar Sankranti and Pongal and Bihu and so many festivals in India. And here's wishing you all a very happy Sankranti. As you all know that the last 2 years have been really ravaged by the COVID-19 pandemic and the health systems were challenged. And we hope that this year we can put all that behind us and beat the pandemic with courage. Looking at the situation of the pandemic, we kept all our activities online, and the theme of our activities of the annual day is also in line with how to be well, how to avoid cancer, and how to prevent ourselves from getting bogged down by this COVID-19 pandemic. So it's a very interesting guest lecture by Dr. Sonu Suba and followed by a very interesting panel discussion again by a team of experts. And I hope you'll all enjoy the sessions and have a very useful take-home messages from that. So as you all know that ICMR and all its institutes, including NICPR at the forefront, rose to the challenge posed by the COVID-19 pandemic during the past 2 years. And the institutes expanded their mandate and rose to the occasion to provide their services to contain the pandemic. NICPR also established a high throughput lab and in July 2020, which was inaugurated by the Honorable Prime Minister. And since then, it has been running 24/7 daily and tested more than 21 lakh samples, RT-PCR samples, which is a humongous task. And all of our staff in the lab, they have contributed with full dedication in shift duties without taking long leaves. And despite some of them having had infections and their family members themselves. And our scientists have trained them well and they carry out regular training sessions to update their knowledge and skills. And we've had a good number of these project staff working in the high throughput lab who have gone in for higher academic studies successfully. They've got better jobs successfully after having worked in our lab for a year or so. And some of them have also got PhD admissions in foreign universities. So, which is really very good for the reputation of NICPR. And the governments of Uttar Pradesh and Delhi have lauded our wonderful testing support, and our lab has provided them all the time. So 3 cheers for the COVID warriors. And apart from the lab, we have also been able to provide lot of help and extended a lot of help not only to our own staff but also to the ICMR staff and the DHR staff in getting them hospital admissions during the second wave when this was so difficult to do. And some of them needed oxygen, some of them needed just plain and simple advice to stay at home. So all that we have been able to provide with the support of the district administration and people who were in our social circle in different hospitals and medical colleges. And also for this, I'd especially like to thank my husband who had provided a lot of support and help in these matters. The Institute participated in all 4 rounds of the National COVID Zero Survey for the districts of the Gautam Budh Nagar, Amroha and Saharanpur. And for these activities, the district administration support is worth appreciating. The district in the districts and clusters of Delhi and Haryana, we also carried out the tuberculosis survey, which was a national priority. Even when there was a COVID pandemic, our teams went to these clusters and they carried out the tuberculosis survey, which is also very well appreciated by the ICMR headquarters and also at the national program level. And our scientists also participated in the National Task Force study on mental health issues of the health workers in COVID who were engaged in COVID containment. And this brought into focus their problems and their challenges that they faced during the pandemic and evoked a caring and empathetic response from the public and the policymakers. Further, the institute also contributed to the control of smokeless tobacco with full support from the ICMR headquarters, the ministry, and the WHO Framework Convention on Tobacco Control Secretariat. And we contributed very useful suggestions for the COTPA amendment. And also we had several knowledge and awareness raising webinars from time to time. And there were very important and publications published in high impact journals, which indicated that what is the relationship between tobacco, alcohol, and what is the kind of usage in the whole country, which had not been studied below the subnational level. And it also these publications were also released at a time when, some of the publications on tobacco were indicating that it is useful and those people who use tobacco will get milder COVID-19 infections. So at that time, we busted this myth. And fortunately, a lot of papers were on such topics were withdrawn. So we also informed the scientific community about the tactics of tobacco industry and also what is the code of conduct which people should follow, especially the scientists, when dealing with tobacco industry. And also we published on how women are being targeted for tobacco use and they are vulnerable. And the big tobacco industry really needs to be controlled. And now then, as soon as this lockdown was over, we began our outreach activities and projects, and we are building wider contacts in the nearby hospitals and so that we are able to handle such situations better and to facilitate research through memoranda of understanding. Another feat which NICPR had was we drafted a online training course for cytopathologists, which is going to be initiated soon in February. And it has digital slides and all modern technology is being used to train cytopathologists online. And the good thing was that during the first 24 hours of the announcement of this course, all the seats were taken up and we had to take off the advertisement, which speaks of volumes for this, the kind of course and the high standards of this course and what efforts the scientists have put in crafting this course. Also, we wanted our former first director and former additional DG, Dr. Usha Luthra, to be able to grace this occasion. But again, because of the pandemic, we could not bring her here. And because of her age, she said that, let's just have a conversation and then you can spread this message to the Institute staff. So in conversation with her, she told me that it is very important that we also evaluate the impact of the screening programs of cancer. And especially we can do this in the field practice area of NICPR. So we shall certainly do that, madam. That's what I told her. And we also remember her contribution not only to NICPR, but also to the division of the non-communicable diseases at the headquarters. She started the cancer registry, which is taken forward by the NCDIR in Bengaluru, and various other initiatives, including on cardiovascular diseases, which are still continuing. And Dr. Luthra also emphasized that the links between cancer and other non-communicable diseases should be thoroughly studied. and not only at the cellular level, but also at the individual level and the population level. So we thank Madam Luthra for her guidance and her wise counsel. Now, we have been joined by 4 new scientists last year after a big, long gap, and we are thankful to the ICMR headquarters for having placed these scientists in our institute. Also, last year we had, after a string of having transfers of the administrative staff, 4 administrative officers were transferred during the last year itself, and now we have a full-time administrative officer and a full-time accounts officer, and they have a lot of responsibilities on their shoulders, but I'm sure they will deliver, and they're both very capable, and they have the support of their teams. So with that, I wholeheartedly thank the entire team of NICPR, the scientists, the technical staff, the administrative staff, project staff, support staff, for their understanding and cooperation and the team spirit with which NICPR has moved forward and had risen to the occasion in the midst of COVID crisis. And I'm sure with all this together, we will still shine. And my sincere thanks to our Secretary, DHR and DG ICMR and all the staff of the ICMR headquarters who have supported us in our research work and in our journey. And we also thank all the members of our experts groups, especially our Scientific Advisory Committee Chair, Dr. Maqsood Siddiqui, who has always been very supportive of our activities. We also thank all our collaborators and the patients who have been with us on this journey. And again, a very warm welcome to all of you for this interesting online session and for the whole year of 2022, and wishing you all a healthy and a joyous year. Thank you very much.